When you listen to a patient's lungs, you aren't just listening for breath. You're listening for a story. Every pop, whistle, and rattle is a sign of what's happening deep inside the tissue. Today, we're going beyond just identifying the sounds. We're looking at the why. We're breaking down the 5 major abnormal lung sounds, the physics behind them, and the conditions that cause them. Let's get into it. Don't just listen in one spot. We use a ladder approach, comparing left to right, starting at the apices, the tops above the collarbone, moving down to the mid-axillary, under the armpits, and checking the bases at the bottom of the ribs. For a through exam, listen to the back, posterior, as well, as fluid often settles there first. 1. Crackles or Rales. First, we have crackles. These sound like light popping, clicking, or even Velcro being pulled apart. What's happening? Imagine tiny, sticky balloons. In conditions like pneumonia or congestive heart failure, the small air sacs, the alveoli, fill with fluid or collapse. The why? As you inhale, air pressure forces these collapsed or fluid-heavy sacs to snap open. That sudden explosion of the sac walls is what creates the popping sound you hear at the end of a breath. Common causes: heart failure, fluid backup, pneumonia, infection/pus, and pulmonary fibrosis, scarring. Crackles, Rales, often suggests pulmonary edema. Think CPAP, continuous positive airway pressure, to push that fluid out of the alveoli. 2. Wheezing. Next is wheezing. This is a high-pitched musical whistle, usually heard when the person is breathing out. What's happening? Think of a garden hose with a kink in it. When you try to push water through that tiny gap, it hisses. In asthma or COPD, the airways, bronchioles, become narrow due to muscle spasms or swelling. The why? As air is squeezed through these tight, narrow tubes, it creates high-frequency vibrations against the airway walls. That vibration is the musical note you hear. Common causes: asthma, COPD, and severe allergic reactions. Wheezing usually indicates a need for bronchodilators, like a metered dose inhaler/albuterol. 3. Rhonchi. Now we have rhonchi. These are low-pitched, rumbling sounds that often sound like snoring or gurgling. What's happening? Imagine blowing air through a straw into a thick milkshake. In bronchitis, the larger airways are filled with thick, heavy mucus. The why? The air has to force its way past this gunk. This creates turbulence in the large tubes, leading to a low-frequency rattle. This is why these sounds often change or disappear if the patient coughs. They've literally moved the mucus out of the way. Common causes: chronic bronchitis, COPD, or cystic fibrosis. Rhonchi, think oxygen/encourage coughing. 4. Stridor. Stridor is the sound that should put you on high alert. It's a harsh, high-pitched, vibrating sound heard mostly when the person is breathing in. What's happening? This is a bottleneck at the top of the airway, the larynx, voice box, or trachea, windpipe. The why? Because the blockage is in the largest, stiffest part of the pipe, the air becomes extremely turbulent. It's the sound of air struggling to get through a dangerously small opening. Common causes: croup, common in kids, choking on a foreign object, or severe throat swelling, anaphylaxis. Stridor. This is an upper airway obstruction. Think oxygen, rapid transport, and being ready for a complete airway closure. 5. Pleural friction rub. Finally, the pleural friction rub. This sounds like a creaking floorboard or leather rubbing together. What's happening? Your lungs have a slippery lining called the pleura. Normally, these layers glide over each other with zero friction. But in pleurisy, these layers become inflamed, dry, and rough, like sandpaper. The why? Instead of sliding, the two rough surfaces grate against each other every time the chest expands. It's a mechanical friction sound. Common causes: pleurisy, inflammation, pneumonia, or pulmonary embolism. Pleural friction rub. Think supportive care and oxygen. EMT study cheat sheet include in video description. Inhalation whistle. Stridor, upper airway. Exhalation whistle. Wheezing, lower airway. Popping/Velcro. Crackles, fluid in alveoli. Snoring/gurgling. Rhonchi, mucus in bronchi. Sandpaper/creaking. Pleural rub, inflammation. Recognizing these sounds is about more than just checking a box. It's about understanding the mechanics of a patient's struggle. If you hear stridor or see someone turning blue, get help immediately. If you found this breakdown of the why behind the sound helpful, make sure to like, subscribe, and leave a comment on which medical topic you want us to tackle next. Thanks for watching.